Welcome to week 13 of your pregnancy journey. This week marks a pivotal moment as you step into the second trimester. Join us as we explore the incredible developments happening with your baby and your body. Let's dive right in. At 13 weeks, your baby continues to grow and thrive in amazing ways. Let's uncover the significant milestones they are reaching. 1. Size and appearance. Your baby is now about the size of a lemon, measuring around 2.9 inches in length. Their body is becoming more proportional, and their head is no longer as large in comparison to the rest of their body. 2. Movement. While you might not feel it yet, your baby is moving their limbs and practicing various movements. Their tiny arms and legs are now coordinated enough for them to make jerky motions. 3. Fine hair. Your baby is covered in fine hair called lanugo, which helps regulate their body temperature. This hair will gradually disappear before birth. 4. Digestive system. Your baby's digestive system is developing, and their intestines are growing longer and more complex. They are even starting to practice swallowing and digesting amniotic fluid. 5. Developing taste buds. Your baby's taste buds are forming, and they can actually taste the amniotic fluid they swallow. This early exposure to different flavors might influence their preferences after birth. 6. Skeleton and bones. Your baby's bones are growing and hardening, transforming from soft cartilage to solid bone. This process will continue throughout the pregnancy. While your baby is achieving incredible milestones, let's discuss what's happening with you during week 13. 1. Second trimester energy. The second trimester often brings a surge of energy, allowing you to feel more vibrant and active. Take advantage of this newfound vitality and engage in activities you enjoy. 2. Maternal changes. You might notice your baby bump becoming more pronounced as your uterus continues to expand. Some women experience a pregnancy glow due to increased blood circulation and hormone changes. 3. Improved appetite. Many women experience an improvement in appetite during the second trimester. It's important to nourish your body with a balanced and nutritious diet to support your growing baby. 4. Reduced nausea. For many women, morning sickness begins to subside by week 13. However, remember that pregnancy symptoms can vary, and some women might experience nausea throughout their pregnancy. 5. Emotional well-being. Hormonal changes might lead to emotional shifts. Many women find that the second trimester brings greater emotional stability and a sense of well-being. 6. Prenatal care. Continue attending your prenatal appointments to ensure both you and your baby are healthy and thriving. Regular checkups, screenings, and tests are vital components of your pregnancy care. Your healthcare provider will guide you through every step of your pregnancy journey. Don't hesitate to ask questions and share any concerns you may have. Maintaining a healthy lifestyle remains crucial during the second trimester. Focus on a balanced diet, regular exercise, and proper hydration. Adequate rest and stress management techniques can contribute to your overall well-being. Week 13 signifies a remarkable milestone as you enter the second trimester of your pregnancy. Embrace the changes and enjoy this special phase of your journey. Join us next time for week 14, as we continue to explore the wonders of pregnancy together. Welcome to week 14 of your pregnancy, your baby's growth and changes. In this video, we'll explore the exciting developments that take place during the 14th week of pregnancy. At this stage, your baby is about the size of a lemon, measuring around 3.5 inches from head to bottom. They're growing rapidly, and their body is becoming more proportional. By week 14, your baby's facial features are becoming more defined. Their eyes have moved closer to the front of their head, and their ears are developing on the sides. Tiny tooth buds are forming beneath their gums, although they won't be visible for some time. Your baby's movements are increasing too. While you might not feel them just yet, your baby is already busy wiggling their fingers and toes. Their limbs are becoming more flexible, and they might even be practicing tiny kicks and stretches. The placenta, which provides essential nutrients and oxygen to your baby, is growing stronger and more efficient. It's now taking over the role of hormone production from the corpus luteum. As for you, the second trimester often brings relief from some of the early pregnancy symptoms. Many women experience a decrease in nausea and fatigue as their bodies adjust to the changing hormone levels. However, you might notice some new changes too. Hormones can slow down digestion, leading to issues like constipation and indigestion. Eating small, frequent meals and staying hydrated can help manage these discomforts. Staying active remains important. Prenatal yoga, walking, and swimming can help you maintain your fitness levels and alleviate pregnancy-related aches and pains. Your healthcare provider might recommend prenatal vitamins that contain essential nutrients like folic acid and iron. These help support your baby's growth and development. Week 14 is also a good time for a prenatal checkup. Your healthcare provider will monitor your health and your baby's progress. If you haven't already, you might discuss prenatal screenings and genetic tests. Emotionally, you might find yourself feeling more connected to your baby as their movements become more pronounced. It's a great time to consider starting a journal to document your thoughts and experiences during pregnancy. As you move through the weeks, it's important to stay informed about the changes your body and your baby are undergoing. Every week brings new discoveries and milestones. Welcome to Pregnancy Week 15, your baby's transformation. In this video, we'll dive into the incredible changes happening during the 15th week of your pregnancy. At 15 weeks, your baby has grown to about the size of an apple. Their body is becoming more proportional, and they're looking more and more like a tiny human every day. This week, your baby's facial features continue to develop. Their eyes, which were initially on the sides of their head, are moving closer to the front. Their ears are also shifting into their final positions. While you might not feel it yet, your baby is getting quite active in there. They're moving their arms and legs and even practicing swallowing and sucking. These movements help strengthen their muscles and bones. Your baby is now surrounded by amniotic fluid, which plays a crucial role in protecting them and allowing for their movements. This fluid will continue to increase as your pregnancy progresses. As for you, the second trimester often brings a welcome relief from some of the early pregnancy symptoms. You might find that your energy levels are higher, and you're feeling more like yourself again. Your blood volume is increasing to accommodate your growing baby's needs. This can lead to healthier-looking skin and a natural glow, often referred to as the pregnancy glow. A balanced diet rich in nutrients like protein, calcium, and iron is important for your baby's growth. Incorporating a variety of fruits, vegetables, whole grains, and lean proteins will provide you and your baby with essential vitamins and minerals. Week 15 is a great time for a prenatal checkup. Your healthcare provider will listen to your baby's heartbeat, measure your belly, and discuss any concerns or questions you might have. Emotionally, you might be feeling a stronger connection to your baby as their movements become more noticeable. Taking time for self-care, practicing relaxation techniques, and connecting with other expectant parents can help alleviate stress. Your baby is growing rapidly, and their skin is becoming more opaque as fat accumulates underneath. This fat will help regulate their body temperature once they're born. Each week of pregnancy is filled with unique developments and milestones. Staying informed about these changes can help you feel more connected to the incredible journey your body and your baby are on. Thank you for joining us for Pregnancy Week 15. As your baby grows and transforms, embrace these moments and look forward to the exciting weeks ahead. Stay tuned for more insights into the wonders of pregnancy. Welcome to Pregnancy Week 16, Baby's Growth and Your Milestones. In this video, we'll delve into the exciting transformations happening during the 16th week of your pregnancy. At 16 weeks, your baby has come a long way. They're now about the size of an avocado. Their tiny body is growing rapidly, and their features are becoming more refined. This week, your baby's eyes are moving closer together, and their ears are almost in their final positions on the sides of their head. Their little face is taking on a more distinct human appearance. You might start feeling those fluttering movements, also known as quickening. These gentle sensations are your baby's way of communicating and stretching their developing muscles. The placenta continues to grow and play a vital role in nourishing your baby. It's busy delivering nutrients and oxygen while also removing waste products. As for you, the 16th week often brings a renewed sense of energy and well-being. Many women find relief from the nausea and fatigue that often accompany the early stages of pregnancy. Your cardiovascular system is working harder as your blood volume increases to support both you and your growing baby. This can sometimes lead to slightly lower blood pressure, so make sure to stay hydrated. A balanced diet is crucial for both your well-being and your baby's growth. Focus on whole foods rich in protein, calcium, and iron. These nutrients are essential for healthy development. Week 16 is a great time for your prenatal checkup. Your healthcare provider will listen to your baby's heartbeat, discuss your overall health, and address any questions or concerns you may have. Emotionally, the bond between you and your baby may be growing stronger as you feel those initial movements. Take time for self-care, practice relaxation techniques, and share your experiences with loved ones. Inside your womb, your baby's muscles are becoming stronger, and their nervous system is developing rapidly. They're even beginning to form their unique fingerprints. Each week of pregnancy brings new discoveries and milestones. Staying informed about these changes can help you connect with the incredible journey you're on. Thank you for joining us for Pregnancy Week 16. As your baby's features become more defined and their movements more pronounced, savor these moments and look forward to the amazing weeks ahead. Welcome to Pregnancy Week 17. What's happening inside? At 17 weeks, your baby is growing and developing at a remarkable pace. Let's take a closer look at what's going on during this exciting time. Your baby is now about the size of a pear, roughly 5.1 inches, 13 centimeters, from crown to rump, and weighs around 5 ounces, 140 grams. Facial features are taking center stage. Your baby's eyebrows and eyelashes are forming, and their eyes, which were previously on the sides of their head, are now moving closer to their final position in the front. While you might not feel it just yet, your baby is quite active inside your womb. They're practicing various movements, like flexing their tiny arms and legs and even performing somersaults. Some mothers start feeling these movements, often referred to as quickening, around this time. The placenta, your baby's lifeline, is maturing too. It's efficiently delivering vital nutrients and oxygen to your baby and removing waste products. For you, the second trimester often brings a boost in energy and a decrease in some early pregnancy symptoms. Many women experience relief from nausea and fatigue during this time. Your cardiovascular system is working harder to accommodate the increased blood volume required to support both you and your growing baby. This can sometimes result in slightly lower blood pressure, so remember to stay hydrated. Proper nutrition is essential. Focus on a well-balanced diet rich in nutrients like protein, calcium, and iron. These nutrients play a crucial role in your baby's development. It's a good idea to schedule your prenatal checkup around this time. Your healthcare provider will monitor your baby's growth, listen to their heartbeat, and discuss any questions or concerns you may have. Emotionally, you might be forming a deeper connection with your baby as their movements become more pronounced. Take time for self-care, relaxation techniques, and share this special journey with loved ones. Inside your womb, your baby's bones are hardening, and their muscles are getting stronger. They are also beginning to develop a layer of fat beneath their skin, which will help regulate their body temperature. Every week of pregnancy brings new discoveries and milestones. Keep track of these changes to better understand the incredible journey you and your baby are embarking on. Thank you for joining us for a glimpse into Pregnancy Week 17. As your baby's features become more defined and their movements more noticeable, cherish these moments and look forward to the exciting weeks ahead. Welcome to Pregnancy Week 18. Your baby's growth and what to expect. In this video, we'll delve into all the exciting details of the 18th week of pregnancy. At 18 weeks, your baby is growing by leaps and bounds. Let's start with the size comparison. Your baby is about the size of a sweet bell pepper, roughly 5.6 inches, 14.2 centimeters, from crown to rump, and weighs around 7 ounces, 200 grams. This week, your baby's facial features are coming into sharper focus. Their eyebrows are developing, and their eyes, previously on the sides of their head, are moving closer to their final position in the front. Those subtle movements you've been feeling are now becoming more pronounced. Your baby is stretching, flexing their limbs, and might even be practicing their first kicks. The placenta, your baby's life support system, continues to function efficiently. It's responsible for delivering the nutrients and oxygen your baby needs while removing waste products. Let's talk about your changing body. You might notice that your baby bump is becoming more noticeable. Your uterus is expanding to accommodate your growing baby. Your cardiovascular system is working hard to support you and your baby. Your blood volume is increasing, and this can sometimes result in slightly lower blood pressure. Staying hydrated is essential. Nutrition remains crucial. Aim for a well-balanced diet rich in nutrients like protein, calcium, and iron to ensure your baby's healthy development. It's a good time to schedule your prenatal checkup. Your healthcare provider will monitor your baby's growth, listen to their heartbeat, and discuss any questions or concerns you may have. Emotionally, you might be forming a deeper connection with your baby as their movements become more pronounced. Take time for self-care, relaxation techniques, and share this special journey with loved ones. Inside your womb, your baby's bones are hardening, and their muscles are getting stronger. They're also developing a waxy protective substance called vernix on their skin. Now, let's address some common questions. At 18 weeks, you're officially 4.5 months into your pregnancy. It's the midpoint of the second trimester, a time when many women experience increased energy and reduced nausea. Speaking of symptoms, you might still be dealing with occasional bouts of fatigue and some pregnancy-related aches and pains. Remember, these are typical during this stage, but always consult your healthcare provider if you're concerned. Your baby's senses are developing too. They can hear sounds, including your voice and heartbeat, and they might even react to external stimuli. Maternal health is paramount. Continue taking prenatal vitamins, staying active, and practicing good hygiene and self-care. Thank you for joining us for a comprehensive look at Pregnancy Week 18. As your baby's features become more distinct, and their movements enchant you, embrace this incredible phase of your pregnancy journey. Welcome to Week 19 of your pregnancy. By now, you're hopefully in the honeymoon phase of pregnancy, meaning most unpleasant symptoms have faded and you're feeling less tired and more human. You are in your 5th month of pregnancy this week, although doctors generally refer to pregnancy by weeks instead of months. In this video, we'll provide you with an update on what's happening with you and your baby during this exciting time. Let's dive in. Baby size. At 19 weeks, your baby is approximately the size of a mango, measuring around 6.0 to 6.8 inches, 15.2 to 17.3 centimeters, from crown to rump. They weigh about 8.5 to 10.5 ounces, 240 to 300 grams. Skin and vernix. Your baby's skin is still thin and translucent, but a waxy protective substance called vernix is forming on their skin. Vernix helps protect their delicate skin from the amniotic fluid. Hearing. Your baby's inner ear is developing, and they can hear sounds from the outside world, including your voice, heartbeat, and even some muffled sounds from the outside. Taste. Taste buds are forming on your baby's tongue, and they may be able to taste the flavors of the amniotic fluid. Baby's movements. Your baby's movements are becoming more coordinated. You may feel gentle kicks, punches, or somersaults. Some of these movements might be strong enough for you to notice. Maternal changes. Let's look at what's going on with mom this week. Visible baby bump. By now, your baby bump is likely becoming more prominent and noticeable. You may need to start wearing maternity clothes. Skin changes. Some women experience changes in their skin, such as darkening of the areolas, the area around the nipples, and the appearance of a linea nigra, a dark line running from the belly button to the pubic bone. Hair and nail growth. Some women report faster hair and nail growth during pregnancy, attributed to hormonal changes. Prenatal checkups. It's important to continue attending regular prenatal checkups with your healthcare provider. These appointments typically include monitoring your baby's growth, checking your blood pressure, and discussing any concerns you may have. Emotional connection. As your baby's movements become more pronounced, you may feel a stronger emotional connection to your little one. Bonding with your baby can be a beautiful and reassuring experience. Maternal health. Continue to focus on your overall health. This includes maintaining a balanced diet, staying hydrated, getting regular exercise, and practicing relaxation techniques to manage stress. Common symptoms. While some symptoms like morning sickness may have improved, you might still experience symptoms like backaches, constipation, and occasional leg cramps. These are normal during pregnancy, but if they become severe or concerning, consult your healthcare provider. Preparing for baby. This is a good time to start thinking about preparations for your baby's arrival. Consider creating a birth plan, setting up the nursery, and taking prenatal classes if you haven't already. Remember that every pregnancy is unique. And while these developments are typical for most women at 19 weeks, it's essential to consult your healthcare provider for personalized guidance and to address any specific questions or concerns you may have during this exciting time. Thank you for joining us for an in-depth look at Pregnancy Week 19. Embrace the changes, cherish the connections, and look forward to the exciting journey ahead. Stay tuned for more insights into the wonders of pregnancy. Welcome to another exciting milestone in your pregnancy journey. 20 weeks. You're officially halfway there. In this video, we'll dive into what's happening during this significant stage. First, let's talk about your baby. At 20 weeks, your little one is growing rapidly. They're about the size of a banana, measuring around 6.5 to 10.5 inches long and weighing roughly 10.6 ounces. One of the highlights of this week is the anatomy scan. It's a detailed ultrasound that checks your baby's development, including their organs, limbs, heart, and more. If you wish to know, this is also when you can find out the baby's gender. You've probably been feeling some movement already, but now those baby kicks are becoming more pronounced and frequent. It's an incredible sensation that allows you to bond with your baby. Physically, you may notice some changes in your body. Your belly is growing, and you might have that unmistakable baby bump. Some women experience backaches or round ligament pain, so it's essential to practice good posture and seek relief techniques. On the emotional front, hormones can play tricks on your mood. You might experience mood swings or heightened emotions. Remember, it's perfectly normal, and seeking support from loved ones is a great way to cope. Your baby's inner ear is developing, and they may start responding to sounds from outside the womb. Consider talking to your baby or playing soothing music to connect even before birth. Continuing with your prenatal care is crucial. Follow your healthcare provider's guidance on nutrition, exercise, and prenatal vitamins to ensure a healthy pregnancy. And finally, if you've been eagerly awaiting to find out, the 20-week ultrasound is often when you can learn your baby's gender. It's a moment of excitement and anticipation. As you reach the halfway point, remember that every pregnancy is unique. Keep the lines of communication open with your healthcare provider, and enjoy this special time as you prepare for the arrival of your little one. Welcome to another week of your incredible pregnancy journey. Today, we're diving into what's happening at 21 weeks of pregnancy. At this stage, your baby is growing steadily. They're about the size of a large banana, measuring around 10.5 to 11.8 inches long and weighing approximately 12.7 to 14.1 ounces. One of the exciting developments at 21 weeks is your baby's developing taste buds. They're starting to experience different flavors from the amniotic fluid, laying the foundation for their future food preferences. As for you, you may be feeling more energetic now, especially if you experienced fatigue in the first trimester. However, you might also notice some common pregnancy symptoms, like backaches or leg cramps. If you're dealing with back pain, consider exercises that help strengthen your back and abdominal muscles, or consult your healthcare provider for relief options. Nutrition continues to be vital. Ensure you're getting a balanced diet rich in essential nutrients. Foods high in calcium, iron, and folic acid are especially important. By now, your baby's movements are becoming more coordinated. You might feel distinct kicks, somersaults, or even hiccups. Cherish these moments as they're precious signs of your baby's well-being. Don't forget to keep up with your regular prenatal checkups. Your healthcare provider will monitor your baby's growth and ensure both you and your little one are healthy. Lastly, remember to take time for self-care and relaxation. Stress management techniques, like meditation or prenatal yoga, can help you stay calm and connected with your growing baby. Now, let's talk about the changes happening in your body. Your uterus is continuing to expand to accommodate your growing baby. As a result, you'll notice that unmistakable baby bump becoming more pronounced. Some women experience leg cramps during pregnancy, particularly at night. Gentle stretching exercises and keeping hydrated can help alleviate these discomforts. As you reach the midway point of your pregnancy, it's a great time to start thinking about your baby's nursery. Shopping for baby items, choosing a crib, and decorating the nursery can be a fun and exciting process. Bonding with your baby is a beautiful experience. Consider reading to your baby bump, playing soothing music, or simply talking to your little one. They can hear your voice and might even respond to it. Another significant event at 21 weeks is your second ultrasound, often known as the anatomy scan. This detailed scan checks your baby's growth and development, ensuring that everything is on track. Let's get back to your baby's taste buds. While they're not tasting specific foods, their developing sense of taste will play a role in their food preferences later in life. So, it's essential for you to maintain a balanced and healthy diet. As your pregnancy journey continues, consider engaging in prenatal yoga or meditation. These practices can help alleviate stress, promote relaxation, and connect you with the miracle growing within you. Finally, savor those moments when you feel your baby's kicks and movements. It's a special connection between you and your little one, and it's a reminder that the journey to parenthood is filled with wonder. As you celebrate 21 weeks of pregnancy, enjoy these moments and the anticipation of meeting your little one. Every week brings new wonders, so savor this beautiful journey. Welcome to another week of your amazing pregnancy journey. In this video, we're diving into what happens at 22 weeks of pregnancy. At 22 weeks of pregnancy, you and your baby are experiencing various changes and developments. Baby's development. Size and weight. Your baby is growing steadily and is now approximately the size of a papaya. At this stage, they measure around 10.9 to 11.8 inches, 27.8 to 30 centimeters, and weigh about 15.2 to 17.8 ounces, 430 to 505 grams. Organ development. Your baby's internal organs are continuing to develop. The lungs, although not fully functional yet, are preparing for the first breath by producing surfactant. The pancreas is also developing, which will play a role in regulating blood sugar. Hair growth. Fine hair, known as lanugo, continues to cover your baby's body, helping to regulate their body temperature. Eye development. Your baby's eyelids, which were fused shut until now, begin to open. However, their vision is still limited, and they can only perceive light and darkness. Maternal changes. Baby bump. Your growing uterus is more noticeable, and your baby bump is continuing to expand. It's becoming increasingly common for strangers to notice that you're pregnant. Skin changes. Some women may notice changes in their skin, such as the appearance of a linea nigra, a dark line that runs down the belly, and chloasma, dark patches on the face. Heartburn and indigestion. As your uterus grows, it can put pressure on your stomach and intestines, which may lead to heartburn and indigestion. Eating smaller, more frequent meals and avoiding trigger foods can help alleviate these symptoms. Breast changes. Your breasts are continuing to change, preparing for breastfeeding. You might notice that your areolas have darkened, and you may experience colostrum leakage, a precursor to breast milk. Fetal movement. By 22 weeks, you should be feeling your baby's movements regularly. These may include kicks, rolls, and flips, which can often be seen and felt from the outside. Prenatal appointments. Regular prenatal checkups with your healthcare provider are essential to monitor your health and your baby's progress. These appointments include blood pressure checks, urine tests, and discussions about any concerns or questions you have. Fetal viability. While the chances of your baby surviving outside the womb at 22 weeks are still quite low, medical advances have improved the odds for preterm babies. However, The primary goal is for your baby to continue growing and developing in the womb. As always, it's crucial to consult with your healthcare provider for personalized guidance and to address any specific concerns or questions you have during your pregnancy. As you celebrate 22 weeks of pregnancy, remember that each week brings new wonders and challenges. Enjoy this beautiful journey and stay connected with your growing baby. Welcome to another week of your amazing pregnancy journey. In this video, we're diving into what happens at 23 weeks of pregnancy. At 23 weeks of pregnancy, both you and your baby are experiencing a variety of changes and developments. Size and weight. Your baby is growing rapidly and is now about the size of a large mango. They measure around 11.4 to 12.4 inches, 29 to 31.5 centimeters, in length and weigh approximately 1.1 to 1.4 pounds, 500 to 635 grams. Vernix caseosa. Your baby's skin is covered with a protective layer called vernix caseosa. This creamy substance helps shield the baby's delicate skin from the amniotic fluid. Rapid brain growth. Your baby's brain is developing rapidly, and they are starting to exhibit more complex behaviors like sucking their thumb, yawning, and responding to sound. Practice breathing. Although the baby's lungs are not fully developed, they are practicing breathing by inhaling and exhaling amniotic fluid. This is crucial preparation for breathing air after birth. Maternal changes. Weight gain. You may have gained between 12 to 15 pounds, 5.4 to 6.8 kilograms, by this point, but the total weight gain can vary based on your pre-pregnancy weight and health. Stretch marks. Some women may notice the appearance of stretch marks on their abdomen, breasts, or thighs. These are common and often fade over time. Braxton Hicks contractions. You might experience Braxton Hicks contractions, which are mild, irregular contractions that prepare the uterus for labor. These contractions are typically painless and sporadic. Swelling. Swelling, especially in the feet and ankles, can be more noticeable. Elevating your legs and staying hydrated can help alleviate this symptom. Fetal movement. By 23 weeks, you should be feeling your baby's movements regularly. These movements may include kicks, punches, and rolling motions. You may even be able to identify patterns in your baby's activity. Prenatal appointments. Continue with your regular prenatal checkups. Your healthcare provider will monitor your health and your baby's growth. You might have blood tests, glucose screenings, and other routine examinations during this stage. Viability. While the chances of survival outside the womb at 23 weeks are still relatively low, advancements in neonatal care have improved the outcomes for preterm babies. Hospitals with neonatal intensive care units, NICUs, are equipped to provide specialized care if necessary. It's important to maintain open communication with your healthcare provider, address any concerns or questions, and adhere to their recommendations to ensure a healthy and comfortable pregnancy. Welcome to week 24 of your pregnancy. It's an exciting time as your baby continues to grow and develop. Let's dive into what you can expect during this stage. Fetal development. Your baby is now about the size of a large ear of corn, measuring around 11 to 12 inches, 28 to 30 centimeters, in length and weighing roughly 1.3 to 1.5 pounds, 600 to 700 grams. The baby's skin is still quite thin, and you can see blood vessels underneath, but it will continue to thicken as fat is deposited. The lungs are developing rapidly, and while they are not fully mature at this stage, the baby can practice breathing movements by inhaling and exhaling amniotic fluid. Physical changes. You may notice an increase in your baby's movements, as they become more coordinated and responsive to external stimuli. Your belly continues to grow, and you might experience more discomfort and stretching sensations as your uterus expands. Some common pregnancy symptoms like backaches, increased vaginal discharge, and heartburn may persist or become more pronounced. Health and care. Continue with your regular prenatal checkups and ultrasounds. Your healthcare provider will monitor your baby's growth and your overall health. Be vigilant for signs of preterm labor, which can include regular contractions, abdominal pain, pressure in the pelvic area, and a change in vaginal discharge. If you experience any of these symptoms, contact your healthcare provider immediately. Your healthcare provider may recommend a glucose screening test for gestational diabetes if you haven't had one already. Emotional well-being. At this stage, you may start feeling more connected to your baby as their movements become more pronounced and consistent. It's normal to have moments of anxiety or worry about the upcoming birth and becoming a parent. Don't hesitate to discuss your concerns with your healthcare provider or seek emotional support from friends, family, or a counselor if needed. Preparation. Consider taking childbirth education classes if you haven't already. These can help you and your partner prepare for labor and delivery. Start thinking about your birth plan and discuss your preferences with your healthcare provider. Diet and exercise. Continue to eat a balanced and nutritious diet, with a focus on foods rich in essential nutrients like folic acid, iron, and calcium. Stay active with low-impact exercises and consult your healthcare provider for appropriate workout recommendations during pregnancy. It's essential to keep in close contact with your healthcare provider throughout your pregnancy to ensure that both you and your baby are healthy and that any potential issues are detected and managed early. Week 24 is a remarkable stage in your pregnancy journey. Enjoy the moments and take good care of yourself and your growing baby. Welcome back to our pregnancy journey. Today we're diving into week 25. At 25 weeks pregnant, your baby weighs about 1.5 pounds and measures around 13.5 inches. During this time, your baby's skin is becoming less translucent and more opaque. Their taste buds are developing, and they can now taste the amniotic fluid they swallow. Your baby's brain is rapidly developing, and their nerve cells are forming billions of connections. You may notice your baby's movements becoming stronger and more coordinated. As your baby grows, you might start to feel more pressure on your bladder, leading to more frequent trips to the bathroom. Your belly continues to expand, and you may experience some stretching and discomfort as your skin and muscles stretch. At 25 weeks pregnant, you may also find it harder to catch your breath as your growing uterus puts pressure on your diaphragm. You might experience swelling in your feet and ankles, a common symptom called edema. It's important to pay attention to your body and practice good self-care during pregnancy. To help reduce swelling, elevate your feet whenever possible and wear comfortable shoes. As your baby's sense of hearing develops, they can now hear your voice and other sounds outside the womb. This is a great time to start talking and singing to your baby, creating a bonding experience. In addition to physical changes, emotional changes are also common during pregnancy. You may experience mood swings, increased anxiety, or heightened emotions. Maintaining a healthy lifestyle, staying active, and eating a balanced diet can help support your overall well-being. It is essential to attend regular prenatal appointments and discuss any concerns or questions with your healthcare provider. As your pregnancy progresses, it's important to prioritize self-care and take time for relaxation and rest. This is a good time to start thinking about creating a birth plan and discussing it with your healthcare provider. Your partner or support person should also be involved in the process and understand your preferences for labor and delivery. Remember to listen to your body and take breaks when you need them during this exciting journey.